Across the country, doctors are seeing a spike in RSV and flu cases, especially among children. With cases high, doctors are concerned more kids are going to get sick after the Thanksgiving holiday. Well, joining us to discuss this a bit more is Dr. Shalika Katugaha, System Medical Director of Infectious Diseases for Baptist Health. Good morning. Thank you so much for joining us.
Good morning. Thank you for having me.
So tell me, why are we seeing an increase in RSV cases this year?
Sure. So there are more than one reason. So firstly, in the pandemic years, we had masking, physical lockdowns, physical distancing, and these barriers prevented the spread of respiratory viruses. That's one reason. And so now we're, masking less, we're gathering more, and so these viruses can spread. And then the number two reason is because we didn't have this big time flu and RSV season in the past 2 years. We don't, as a community, have immunity against these viruses. For example, for some kiddos, this is their first time ever being exposed to RSV.
Wow. And we know a lot of people spent the holidays with their family. How concerned should parents be about the likelihood of their kids getting infected?
So, it's always something after you gather to watch out for. And there are signs and symptoms that you can watch out for. And so for RSV, for flu, and for COVID, you'll see very many similar symptoms. So fevers, sore throat, congestion, cough, runny nose, those are all symptoms that you can look out for to see if your kiddo has been exposed and is sick.
And how long after exposure can kids start showing symptoms?
Sure. So all of these viruses have different incubation periods, which means the time of exposure to the time of symptom development. So for flu virus, it's usually within 2 days. For RSV, it's more like 4 to 6 days. And then for the Omicron subvariant, it's around 3 to 4 days.
And what are some treatments, that parents should use to help their kids?
Sure. So for flu, please reach out and ask your doctor if an antiviral treatment is available. And then the principles are, and this is similar for RSV and flu, keep them comfortable. So that means acetaminophen or ibuprofen to hold down fevers and to control pain and body aches. Rest, hydration, which means getting, popsicles with electrolytes, high fluid-filled foods. And then finally, for cough and congestion, you can try things like steamy baths, cool mist inhalers, nasal saline via bulb suction.
So let's say we know these families spent Thanksgiving and traveled together. What should they do now that they're back home to kind of monitor their children's symptoms?
Sure. So basically, watch them closely. That's what you can do. You can watch out for symptoms. If someone has symptoms, keep them out of the community, and please get them tested because the symptoms are so similar. And if you haven't already, please get a flu shot for your kiddo.
And we know Christmas is right around the corner, another big travel holiday, a time when we all come together. What should parents do to prepare for that, to kind of lower this risk ahead of time?
Okay, so the first thing, as I just said, is flu shot for your kiddo. If they are eligible if anyone over 5 should have an updated COVID booster. And so to do that, please teach them to wash their hands, decontaminate surfaces as best as you can. If someone is sick, stay away and keep them away. Those are all things that we can do. And so if someone is sick, then sadly, they may not be the ones who get to gather for Christmas.
All right. Thank you so much, Dr. Katugaha. We appreciate having you on this morning.